coli, the stealthy spreader. Imagine a world where a common gut bacterium spreads as swiftly as the notorious swine flu. This revelation challenges our understanding of bacterial infections and prompts a reevaluation of hygiene practices and public health strategies. Recent research has uncovered a surprising truth. A specific strain of E. coli, known as ST131-A, can race through populations at a pace akin to flu viruses. This discovery turns our perception of bacterial infections upside down and has profound implications for how we approach hygiene, hospital safety, and our daily routines in shared spaces. A peer-reviewed study published in Nature Communications analyzed genome data from the UK and Norway, estimating the basic reproduction number, R0, of 3 E. coli strains. The results were eye-opening. ST131 spreads almost as rapidly as H1N1 swine flu, shattering long-held assumptions about bacterial transmission. But here's where it gets controversial. Traditionally, we've believed that bacterial infections primarily spread through contaminated food, water, or direct contact. However, this new research suggests that certain E. coli strains can behave more like airborne viruses, efficiently transmitting between humans. The study examined data from the UK baby biome study and bloodstream infection surveillance, employing sophisticated models to calculate R0 values. The results revealed that ST131-A has a transmission rate similar to some flu viruses, making it a formidable bacterial threat. By utilizing the ELFI, Engine for Likelihood-Free Inference, software, researchers were able to quantify the spread of ST131-A and its antibiotic-resistant relatives, ST131-C1 and ST131-C2. While the ST131-C strains move more slowly, they can accelerate in high-risk settings like hospitals. This insight challenges the notion that gut bacteria are solely individual hazards, highlighting their potential as community-spread pathogens. So, why does the speed of ST131 matter for public health? Well, ST131-A is not just any ordinary gut bacterium. It's a leading cause of urinary tract and bloodstream infections in the UK and Norway. Some of its strains are resistant to multiple antibiotics, and in the UK, over 40% of E. coli bloodstream infections are now resistant to a key antibiotic. A high R0 means each infected person could pass the strain to multiple others, emphasizing the need to rethink our hygiene practices, infection monitoring, and public health interventions. The implications for everyday hygiene and shared spaces are significant. This research underscores the importance of extending hygiene practices beyond the kitchen or bathroom. Shared surfaces, utensils, and close contact in households, daycare settings, and offices can accelerate transmission. In high-risk environments like hospitals and care homes, where vulnerable individuals are concentrated, the rapid spread of ST131 makes infection control absolutely critical. Measures such as isolating infected patients, closely monitoring contacts, and implementing targeted cleaning regimes become essential. Even in our daily lives, simple habits like frequent hand washing, sanitizing shared items, and avoiding sharing utensils when someone is unwell can make a difference in limiting bacterial spread. Understanding that some gut bacteria move like viruses adds a new dimension to our familiar hygiene advice. While the study's results are compelling, they specifically apply to ST131-A and related strains in the UK and Norway. Global transmission patterns may vary, and environmental or behavioral factors could influence spread in other regions. Additionally, the study does not identify all the genetic drivers behind ST131-A's rapid transmission. Researchers emphasize the importance of understanding these drivers to predict and manage future outbreaks effectively. Healthy individuals may still face lower risks compared to those in hospitals or immunocompromised groups, but the main concern remains in high-risk environments. This study opens up exciting possibilities for applying viral transmission models to bacteria more broadly. Tools like ELFI could become standard in estimating bacterial R0 values, aiding public health agencies in prioritizing strains with outbreak potential. Researchers may expand these analyses to other antibiotic-resistant bacteria, such as Staphylococcus aureus or Klebsiella pneumoniae. Policy and hygiene guidelines may also evolve, treating high-transmission bacterial strains more like viruses. Rapid contact tracing, monitoring shared spaces, and updating cleaning protocols could become the new normal in hospitals, care homes, and other communal environments. The revelation that E. coli can spread at flu-like speeds shifts our perception of bacterial risks. It underscores the importance of hygiene, surveillance, and targeted infection control strategies. By recognizing that some gut bacteria behave like viruses, we can take proactive steps to reduce infections and protect public health. Paying attention to high-transmission strains, maintaining shared space hygiene, and monitoring vulnerable populations are now more crucial than ever. Let's embrace this new understanding and work together to create a healthier, safer world. What are your thoughts on this surprising discovery? Do you think it will change the way we approach hygiene and public health? Share your insights in the comments below.